Okay, so today I'm going to be doing a heart exam on you today. So first I'm going to just inspect your hands and your nails, looking for any cyanosis or any abnormalities there, and they look good. And then I'm going to look for your jugular venous pressure, so I'm just going to have you turn your head to the left for me a little bit. And I'm just looking between the two heads of the SCM, looking for the pulse of the jugular vein. And then once I find that, I'm also going to measure it. So I'm going to use the tongue depressor on the top of the jugular venous pressure pulse, and then I'm going to use my ruler and measure at the sternal angle from there, and it should be in a good, you're at about 1.5 centimeters, you're in the normal range, so you're good there. And then I'm just going to inspect that to a tangential lighting, I guess, just to make sure I see it. Good. And then next I'm going to be looking at your just area over your heart for me, or heart, so I'm just going to use, again, tangential lighting, and just looking for your heartbeat, any abnormal pulses or asymmetries. And that looks good there. And then I'm going to look for your apical impulse, which is down here. So if I could have you tissue slack up for me, and I'm just going to first look for the apical impulse. And then if I can't see it, I'm going to have you turn into left lateral decubitus position. So just land on your left side at about a 45-degree angle for me. And here I should be able to see it a little bit better. And then I'm also just going to palpate with my fingers just to feel it. I'm going to have you exhale for me and all the way. And I should just be able to feel a light pulse. Good. All right, and next I'm going to, you can lay back normally, and I'm going to palpate for heaves and thrills. So first, I'm going to have you, I'm just going to place my knife edge on your sternum if you'd like to tissue sack down for me. And I'm just going to feel for any heaves, any the heart should beat under my hand, but if I feel like extra pressure, then that'd be abnormal. And then I'm going to do thrills with just my fingertips at each of the valves. So starting on the aortic valve, second intercostal space, and then pulmonic, and then tricuspid, and then mitral if you want to tissue sack up for me. And I shouldn't be feeling anything here. If I feel anything, that'd be abnormal. And then I'm going to do percussion for your lateral border. So if you want to tissue sack in for me, and I'm just going to percuss finding the lateral border of the heart. Tissue sacking in at the 4th, 5th, or 3rd, 4th, and 5th intercostal spaces. So I'm just going to come in here and percuss. Do you want to move your elbow out of the way a little more? Thank you. Tapping on my knuckle. Just listening for it to go from resonance to dullness to find that lateral border of the heart. And now I'm going to auscultate. So I'm going to take my stethoscope. And first I'm going to use the diaphragm and listen to all the valves and Erb's point, and then I'm going to switch over to the bell and work my way back up. So if you'd like to tissue sack for me down and out to start. So start aortic, and then pulmonic, and then Erb's point, tricuspid valve, and then mitral. And then switching on with the bell, same thing. We work right back up. Good. And then next I'm going to do the special test. So the first one is going to be S2 split. So I'm just going to have you stay laying there, and I'm going to use my diaphragm at the pulmonic valve, and I'm just going to have you inhale deeply for me, and I'm listening for a split. So inhale deeply. Good, sounding okay. Now I'm going to have you sit up, and we're going to listen for aortic regurgitation. So I'm going to sit up, and I'm going to just have you lean forward for me. And then I'm going to have you exhale and then hold your breath. And I'm at the diaphragm on the pulmonic valve. So exhale all the way and then hold. Okay, good. Listen for any aortic regurgitation. And next I'm going to have you lay back down again on your side in that left lateral decubitus position. And I'm going to be using the bell on the mitral valve, listening for mitral stenosis first. So if you'd like to tissue sack for me again. And then I'm going to just have you exhale and hold your breath again for me. So exhale and hold. good. And then the last test is listening for mitral valve prolapse. So I'm bell at the mitral valve again. I'm gonna have you breathe out and then bear down like you're gonna get punched in the stomach or something. All right, and go ahead and bear down. Like my patient's performing the Valsalva maneuver. And that is the last test, so you're good to go.